Dementia and delirium, again, quite obvious, big differences, and they can be very confusing, and sometimes they overlap, and you're not quite sure if they're delirious or demented. So, first of all, dementia is a slow, progressive medical condition, or syndrome as we would call it, where a patient loses more than one more than one brain function. What I mean is, not only do they lose their, let's say, short-term memory, as in Alzheimer's disease initially, but they also lose the ability to maybe speak properly, to walk, lose some executive dysfunction, which means planning abilities, to have some insight. So it's a slow, progressive disease. Now, delirium is an acute confusional state. So the person was fine last night, and this morning the person doesn't recognize their loved ones, is totally confused, agitated. That's not dementia, that's delirium. The problem is that sometimes delirium and dementia overlap, like in the hospital, or when a patient at home develops a serious illness, they become increasingly confused and agitated. So they can have both dementia and delirium on top of each other. The big difference, though, in sort of seeing a patient with dementia, a person with dementia may not recognize a loved one, but can still be attentive. You can talk to this person, he or she will interact with you. A confused patient, a delirious patient, cannot even keep any, there's no attention. You can't talk to this person. This person is literally all over the place, will jump from one thing to the other, can't even make eye contact with you. That's sort of something which is easily recognized even by caregivers. But it's the acute change which really gives it away, not the long-term slow decline in their memory abilities and other brain functions, which is the difference.